Hi everyone, Dr. Emmy from Pain Free and Fit. Today I'm going to be sharing with you the 3 most important lessons of how to work out and exercise with lower back pain. It's a conglomeration of the advice I've given over the last 300 videos on the channel here, and it's the same secrets and advice that I share with my patients and online clients. Hope you enjoy. So the first lesson, which is crucial, is learning what your unique neutral spine position is. A neutral spine position is the position that you place your lower back in. How much of an arch or curve it has, how much of a side bend or rotation it has, how much of a front to back translation the vertebrae have. That puts you in a position to decrease the stresses across your discs, your facet joints, your ligaments, facet capsules, associated muscles and tendons, to decrease the stresses that actually cause injury. Now this is unique for each and every person. Due to our posture and movement habits, our muscle asymmetries that we develop over time, we all have a unique situation. And every patient that I've worked with and every online client that I've helped over the years all have a unique neutral spine that they must learn. It's done through a body analysis, figuring out what are your posture tendencies, what are your movement tendencies, where are your asymmetries. One person, for instance, may have a tendency to hike one hip up more than another. This comes from sitting and standing with one leg out, from sitting with one hip up, from sleeping on one side, their favorite side, versus another. And that tendency to hike a hip up through muscular learning over the course of a lifetime will occur in the gym when you're working out and squatting, when you're lunging. Surely enough, that hip is going to be the one that's going to want to come up. And if it's compressing a disc or facet joint on that side, that's what's perpetuating the stresses that are causing injury. Another person may have a weak stabilizing muscle, say the multifidus. The multifidus are small muscles that run off the back of our spine, several segments, and help hold the vertebrae in a safe position. Many people, because of chronic lower back pain, recurrent back pain, have developed weak multifidus muscles. Even after their pain has gone away, once inflammation has settled down and the nerves have no longer been sensing injury, the multifidus often stay weak. And unless you learn how to retrain them and identify where to engage your multifidus, the vertebra will not be held in the correct position, and that segment will be the one that moves excessively. When you're deadlifting, when you're squatting, when you're overhead pressing, that's the recurrent cause of your injury. So you need to identify where your multifidus is weak and how to engage it. Another person may have a larger global muscle that's dominant or weak. Very common problem in back pain is a weak glute or buttock muscle on one side, complicated by a compensating overactive tight lat muscle on the other side. If my right lat is tight due to, let's say, postural or favoritism in terms of one side is stronger than another, I can pull or push with one side and I've developed a lat muscle that's tighter, or I lean to one side more when I'm driving or working. I'm off to one side working on a computer or a television screen, or I have a tendency to sit to one side. That spinal rotation or lateral flexion has a tendency to tighten one side of the lat or the other. From chronic lower back pain, if I sit a lot, my hip flexors are tight, often the glute on the opposite side will become weak. Now there's a cross strut between your lat muscle and your opposite glute that stabilizes the spine. The lat and the glute both attach to the thoracolumbar fascia. And if one lat is chronically tight, that glute typically is going to be weak. There's not an even pull or a nice symmetrical strut that runs across your spine. Thus, when you're working out, either upper body or lower, needing your lats to help stabilize during the bench press, using your lats during back work, using your glutes to stabilize in the standing position, or any type of lower body work, any type of cycling, running, where they're both being used, swimming, that dysfunction between lat and glute is going to help unstabilize the lower back. The lower back is going to be able to move in certain ways and not be held rigid the way it should be. These asymmetrical forces add up through the body. Many people have overactive internal oblique muscles from leaning to one side, from twisting to one side. If you notice when they do their ab work, their planks, they're going to have a slight tendency to lean to one side, or one hip's going to come up. That's showing us that either the external internal oblique is more dominant on one side, especially if rotation is involved, and that's creating a torque. Discs, for instance, are notoriously aggravated with twisting and compression. And when you have a chronic problem such as an asymmetrical development of the abdominal muscles, especially the obliques, there's going to be a twisting moment that goes into that disc which repetitively irritates it. So learning what your neutral spine position is not only setting the spine from what its typical tendency is. For instance, some people have a tendency to overarch their lower back, their tailbone comes up, or with extension they lean back too much and that compresses the back portion of the spine, irritating either discs or disc herniations, as well as facet joints, or stretching the front of the spine that may be unstable. They have to learn how to set the right amount of curve. They need to learn how to tuck the tail under and avoid a certain range of motion that's going to irritate their pain. Other people with degenerative discs, acute disc herniations, too much flexion, too much losing the arch of their spine is going to irritate their back because that compresses the front of the disc and helps to encourage the movement of internal fluid in the disc, the nucleus, backwards into the herniation. So those people, that's another unique situation. They need to learn how to keep the arch and avoid decreasing the arch too much. So we're all unique, and just because you have a diagnosis of a disc herniation or facet syndrome doesn't mean that you necessarily will fall into one of these categories. You have to have an analysis done on what is the right position of your body. Now, that analysis and movement system and postural analysis of how you move and how you're going to irritate yourself and what to avoid can be done by a rehab specialist if you have one locally, trained doctor in spinal rehabilitation or therapist. You could have another option of going online with me, a Zoom consult, or you can take one of our programs available at painfreeandfit.com. All of our back problems, all of our workout problems all have a self-analysis section where you learn how to analyze yourself. And to get started, although it's not a complete analysis, you could check out the free analysis at painfreeandfit.com. But learning how to place your body in a neutral spine position, engage the muscles correctly so you're holding your spine in a symmetrical and stable way is a key, if not the crucial lesson in preventing lower back pain with exercise. So the second lesson is learning which direction of motion is most hazardous to your spine. Many people have a tendency for flexion or bending forwards where the arch in the lower back is decreased for it to cause pain because they're compressing discs on the front of the spine, they're overstretching soft tissues such as ligaments and tendons and muscles on the back side, and that's going to aggravate their pain. Others, extension, the opposite, leaning back too much, causing an increase in that arch in the lower back, or having the tailbone come up as the pelvis rolls forward, perhaps due to tight hip flexor muscles that are involved. They have a tendency to compress the back of the spine and overstretch the front. That's going to affect their pain. Other people are going to have a tendency to laterally flex too much, and that direction of sideways bending is going to irritate their pain. A sacroiliac joint problem, a problem that's associated with hip hiking where one hip comes up or the rib cage leans in. That's going to irritate their pain because they're compressing that side. People that play rotary sports, for instance, people that golf, people that play baseball, softball, pickleballers, it's all involved in rotation. With rotation, the backside typically has a tendency to also compress because the rib cage leans in during that swing. The hip comes up. So unless you learn how to avoid that direction of motion and stabilize the spine as you go through that motion, you're going to keep irritating yourself. Some people have a translation problem. For instance, people with sway back posture who have their hips held more forward from their torso. They've developed that postural weakness over time. That's going to irritate the spine. That's going to cause a translational problem, front to back. People with spondylolisthesis, retrolisthesis many times have this problem. So if they're doing something in the gym that's lifting or pulling up, typically what they're going to do, especially when the weight gets heavier, they're trying to eke out the last few reps. For instance, with the curl, they're going to swing their hips forward to get that bar up. This may be a very slight sway. You may not see a lot of it, just a little, but it's enough to cause a translational stress and aggravate their back pain. So those people have to learn how to stabilize their hips while they're doing motions or choose other motions to avoid, in that direction, too much range of motion that's going to irritate their pain. Other people may have a vertical translation issue where too much compression is going to irritate their spine. People with DJD, arthritis in their spine, degenerative discs, acute herniated discs, too much compression is going to irritate that. They have to learn how to avoid and hold their core and avoid that slumping and that pressure on their spine as they're working out. Again, this begins through an analysis of your body. If you learn which direction of range of motion is going to typically aggravate your pain and which specific aspect or range of motion within that direction is hazardous, you can avoid it. You can develop a core training routine that's specifically designed to prevent that much range of motion or that direction of range of motion, and then that will be utilized in all of your exercises to prevent aggravating your lower back pain. And then the third lesson is modifying your exercises. Many patients and online clients are surprised to learn that they don't have to give up working out. They don't have to give up exercise with back pain. In fact, I've never met any client or patient that I treat in the office in over 34 years of practice that needed to stop exercising because of back pain. In fact, most of the time they needed more exercise. They just needed to modify the exercise and learn how to exercise safely and choose the proper exercises and form to avoid aggravating their pain. Some people, for instance, if they have back pain with squats, let's say, barbell squats, I can't squat anymore, they think. Actually, that's not true. Many times with squatting, there's a vertical compression on the spine. And if they learn how to do an exercise such as a bar thigh squat, where a bar is placed on top of their thighs, and as they squat, the weight is pushing down on their thighs, you're still getting a great glute and leg workout, hip and leg workout, while doing bar thigh squats. Same can be applied to lunges, working in a Smith machine, for instance, or with a free weight, or even with bands. When that bar is on the thigh and we're moving up and down, there's now virtually no compression on the spine because all the weight has been centered from the hips or upper thighs down, helping to avoid pain. People that do shoulder presses with lower back pain many times have problems. Learning a different technique such as a one-arm shoulder press or a side shoulder press where you're laying on your side and you're pushing the weight upwards, still developing all the shoulder muscles. In fact, the side press many times will develop even more shoulder muscles like the rotator cuff because there's a lot more sway. It's a motion that you're not used to. It's uncommon for a lot of people to work in a sideways direction. Great way to develop the hypertrophy, the strength, the muscle size of deltoids, bodybuilders included, without putting an overhead compression on the spine. People that are into cycling many times have a chronic back issue because they lose the arch in their lower back. The cycling position tends to cause them to flex forward, and sometimes just a little extra flexion in a range of motion is enough to compress that disc or overstretch the back soft tissues. So modifying their cycling simply by scooting the hips slightly back on the seat and raising the handlebars will help to prevent that compression, allow them to still enjoy cycling without hurting themselves. People that are runners many times have faulty mechanics. They run with one foot slightly out more than another, or they run with a hip hiking pattern where when they make contact with the ground, one hip moves sideways or upwards. That's stressing the back. Changing the way you run by learning how to avoid those problems or even improve them slightly can decrease the stress and make running a non-painful activity. I've had patients and clients that are really into Pilates and yoga, for instance, that find that certain movements or postures aggravate their pain, and modifying the range of motion that they go into or the way they're holding their body decreases pain and avoids irritation. Getting back to the gym, people that are heavy bench pressers many times will have a tendency to overarch the lower back as they're bench pressing. Learning how to stabilize it and working within a range of motion can help decrease that. Changing the style of bench press they do can help decrease the stresses. Taking a flat bench and change it into a decline with the legs elevated, for instance, or an incline with a box and the feet underneath it will help to decrease the stress in the lower back and avoid low back injury. Ab work is another big one with people. Many people get into plank positions where they're just trying to hold a top of the push-up position with the body aligned, and they wonder why their low back is hurting. And many times it's because they actually have too much lordosis. As they're hurting and as gravity takes over, the lower back starts to sink down. And it's not a big 3-inch movement, but sometimes it's just a 1/4 of an inch movement, whereas the lower stomach starts sagging towards the ground as they're holding that plank position. You get too much of an arch. So simply learning how to bend your knees slightly, maybe a 1/4 of an inch, tucking your tail under and crunching down with your abs towards your pubic bone as you hold that position can go a long way to not only avoiding back, but many of them tell me that their abs have never had such a great workout. Back works are another common example of irritating the lower back with poor exercise choice. Many people perform in the gym bent over rows. Very hard to stabilize the back down there. Many times that neutral spine position is going to be lost. So switching off to an exercise like a prone row where you're laying face down on an exercise bench and your body is aligned with that bench, it's much easier to hold a neutral spine as you perform the rowing motion. Other people, deadlifts is a big problem. The lower portion of the range of motion in the deadlift many times is where the spine is going to come out of that neutral spine position. When we take slow-mo videos of powerlifters and watch their injuries and when they occur, it's usually in this bottom position. It's much easier to maintain a neutral spine in the top 2/3 or top half of the motion. So performing rack pulls, where your barbell is rested on a power rack and you're using a partial range of motion, you can still deadlift, you can still get great strength gains. You're just going to stay away from that aspect of motion or that range of motion that's going to be painful for you. A lot of my clients in the gym wind up hurting their back with bicep curls. They have a tendency to put a sway motion in to eke out those last few reps. Simply learning how to use a split stance where your back leg serves as a post will help to prevent that motion. So there's a lot of different ways to modify exercises so you prevent lower back stress. If you keep these 3 tips in mind, learning what your neutral spine position is and training yourself to hold that, learning which directions of motion are most painful and learning to curb them or decrease the ranges of motion within them so you stabilize yourself. And 3, always realizing there's a modification to your exercise. If you can't figure it out, somebody else can. Talk to a rehab expert, give me a call, make an online consult, pick up one of our self-help programs at painfreeandfit.com. They're great for helping you learn what your body mechanics are. Do an analysis on yourself. It's easy with this self-help guide to go through your basic problems of your torso, your pelvis, all your spinal stabilizing muscles. Once you learn how to identify where the problems are, all of these programs, no matter if it's degenerative disc disease program, the facet joint program, the spondylolisthesis program, the neck healing exercise program, they're all designed to help you figure out what your issues are, how to correct them, and then how to build a routine around them. So don't despair. Never give up hope. There's always an answer for you and your back pain when it comes to exercise and working out. I hope these lessons, as they've helped me and my patients, will also help you in your fitness and sports-oriented goals.